ENT covers a lot of things that people don't necessarily think about on a day-to-day basis, but it affects them absolutely on a day-to-day basis. So even understanding the impact of hearing on speech development, or the impact of sleep on cognitive development and cognitive performance throughout childhood. I think parents understand it. I don't think they always know there's something we can do about it. Your kid's snoring all night long, maybe that's not normal. Or they have a language delay, maybe they can't hear things. And so a lot of that boils down to just knowing to ask the right questions so you get screened and put in the right place. I think that's a really valuable role that pediatric ENTs play, is capturing those kids. We really get to focus on quality of life. And specifically for me, the quality of life of kids, enhancing things like the way they hear, which then translates into how they can learn language and speech, and then dealing with their breathing or their sleeping or their sense of smell. And those are aspects of life that I think we take for granted unless we don't have them. So to be able to give that back to somebody is huge. And I love that aspect of my job. I've said this countless times throughout my practice. I thought I knew what being a pediatric doctor was. I had kids and they changed everything. I think it not only gave me a better ear for what I'm seeing on the clinical side of things, but also just a better way of sympathizing and empathizing with other families. We love to ski, we love to hike, like to read and ponder philosophy and stuff like that, but ultimately I'm just a big kid. To be able to take a kid from start to finish and say, look, they came in with this problem, and then they're coming out and they're doing better, and the parents are happier, and everybody's just better for what you did, that keeps me going. It's my livelihood.